Schools scrambling to deal with a virus causing concerns and confusion. Now 1 million Hoosier kids are learning the ABCs of an unprecedented year.
There's just so many obstacles and so many, just one little bitty thing that could go wrong.
As the coronavirus pandemic continues, we're making sure that you know how to keep your family safe, whether that means a new learning routine.
I'm not trained to be a teacher. Can I do the same job that the teacher is going to do at school for us?
Or returning to the classroom with new procedures in place.
At the heart of it, we're trying to keep our students and our staff as safe as we can.
Don't just say what people want to hear. Let's actually have a plan and make it make sense.
In this uncertain time, RTV6 is working to get the answers you need to send your children safely back to school. Thank you for joining us for this RTV6 special. I'm Rafael Sanchez.
And I'm Lauren Casey, and we're in an elementary school in Johnson County.
And Lauren, Franklin Community Schools, one of the many school districts in central Indiana, which decided to delay its return to in-person learning, while officials keep track of coronavirus infection rates. And districts are prepared to change their plans at a moment's notice to keep students and teachers safe.
Back when schools closed their doors in March, some districts announced e-learning days. Now that they've had the summer to plan, districts are referring to at-home instruction as remote or virtual learning. But no matter what your family calls it, remote learning for most central Indiana families is a big change.
And for many districts, it's the only option to begin the school year. RTV6's Mark Mullins, he turned to educators to get tips and resources for parents as they begin their new role during this pandemic. When school districts, including Mount Vernon schools here in Greenfield, switched to e-learning in the spring in order to empty their buildings, it was quite sudden. Teachers and students and parents were all learning as they went. Now there's a better plan in place with more resources available. This portrait shows Lori Hargrove, a Franklin College graduate now in her 7th year of educating children, currently teaching in Wayne Township. When COVID-19 started spreading around the state, her students moved from the classroom to virtual learning.
That quick transition to e-learning was interesting and it was hard. I heard a lot of times just families say, I need help, I need help, I need help.
Lori responded to that call for help to be a support system for families. She founded Learn with Lori.
Learn with Lori was inspired just by everything that is transpiring through COVID.
An online service that eases the burden on parents and addresses the struggles that might come in this new age of e-learning. In Greenfield at Mount Comfort Elementary School,
we've actually been getting ready for school and virtual learning, in-person learning since last May.
Principal Alyssa Lockwood is offering advice for parents who may feel overwhelmed with virtual learning.
I think sometimes parents maybe feel the pressure to become the teacher, and really what we want parents to feel, we want them to feel supported from the teacher and not the need to take the place of the teacher.
Principal Lockwood urges parents to reach out to teachers.
We've prepared our teachers and given them, ideas and best practices for virtual learning. And so really we want the parents and the teachers to work together.
Lockwood says as students start this new school year, there will be an increased workload since there has been more time to plan virtual lessons than there was in the spring.
And so this year we're expecting the kids to be on doing their work every day, 5 days a week. And we expect them to have kind of a similar workload to the in-person kids.
That may be a concern for parents who not only oversee their children's e-learning time, but also work from home themselves.
My advice is to build a schedule. Carve out the day, the time that you can commit to helping your child and the time that you need to work on your things at home too.
That structured schedule could help establish a household routine and optimize learning time. In Greenfield, Mark Mullins. Lauren, back to you.
Some parents who have the resources are taking this opportunity to choose a completely new option when it comes to teaching their kids. I met with a family who's planning to homeschool this year for a closer look at how it works.
I think what's good for parents is just simply to know that there are options.
Zach and Megan Duke are living in the Center Grove School District with their 3 kids, Malia, Natalie, and little Judah. Zach is a missionary, Megan a stay-at-home mom and music artist. And just as faith is a common theme in Megan's music, the Dukes are relying on their faith, especially in these uncertain times.
We're just trusting that God is in control, that He's going to continue to lead us and guide us.
The faith just helps us to stay undisturbed in seasons of disturbance.
And they're taking a leap of faith, making the choice to homeschool their children, starting with Malia, who will be in the 1st grade. And it's a change. Zach has had family members in the Center Grove School District since its beginning.
All those who are going to the Center Grove school system, I know they're trying to figure it out. They're working really, really hard, and we want the absolute best for all the families and staff.
Supporting that community is still important while also building a homeschool community for Malia on their family farm.
Creating just a learning environment and atmosphere where she can have some peers as well.
But yet creating a network where there's a tutor that we can have that can have the same curriculum that can help all these families.
And creating a safe space.
It's small, you can distance easy, and you can also communicate with all the parents easily.
Zach and Megan spent a lot of time researching homeschooling, but many parents right now may be just looking at this as an option for the first time.
And maybe now they feel empowered. Some of them maybe feel pushed.
Tara Bentley is the executive director for the Indiana Association of Home Educators. Since 1983, the group has helped homeschooling families get started by answering questions and providing resources and support.
How many more families are contacting you compared to a normal year?
We have seen such a huge spike that I don't even know that we've had time to collect all the numbers.
There's still confusion in the age of COVID-19 as to what is homeschooling.
We have legal requirements that are based on our definition, how we're classified. So it's really important that people do understand the differences.
By definition, homeschooling in Indiana is non-public and non-accredited. Parents report attendance to the state and agree to provide an equivalent education, but the state cannot define that, so there's a lot of freedom.
We look at what the public school is doing maybe as a template, but we are free to decide what that actually looks like.
Bentley says that homeschooling allows parents to customize education to meet the needs of the child, but there are many challenges.
You know, we all hate the term a new normal. I would say it's not normal in any circumstance. And so you have to give yourself grace no matter what choice you make.
And for Zach and Megan, being supportive of all choices is important as we navigate this coming school year.
Giving grace to ourselves and grace to all the other families where we're just trying to figure this thing out.
Something to remember about homeschooling high schoolers: if you want your student to graduate with their local school, you need to work closely with their local district to make sure they're meeting all the graduation requirements.
Where to learn, whether it's math, reading, or writing. For many parents, it's been a long summer, trying to determine whether to send their kids back to the classroom or to continue remote learning. Call 6 Investigates Karaketty shows us that the choice can be even more complicated when you have a child with special needs.
Many parents are torn, and they're looking to school leaders and the State Department of Education for guidance on what to do.
I'm ready.
You're ready for what?
Marvin Selva's 6-year-old daughter, Ambreen, is ready to go back to school.
I thought we could say, let's go ahead and go, but it's very scary.
Like many parents, Marvin has struggled to decide whether to send Ambreen back to Perry Township's Abraham Elementary for in-person learning or choose virtual learning.
I want to prevent her from catching this virus, and it's scary to know that, you know, we're going back to school. What's going to happen? Are they going to do the same thing as I am?
Marvin's decision is further complicated because Ambreen has Down syndrome and other health issues.
Can she keep the mask on for longer than 5 minutes? Is she going to not touch everything? Is she not going to grab things and put things in her mouth?
Call 6 Investigates found more than 165,000 students in Indiana have a disability. The ARC of Indiana is just one of the groups that advocates for them.
Some of them are more susceptible to just illnesses. Some of them have sensory issues where they do enjoy a hug. They do enjoy touching not only their classmates, but their teachers.
Executive Director Kim Dodson says so far it's a mixed bag from parents.
It's 50-50. I think for every 2 parents we hear from that says, I am absolutely not sending my child back, we get 2 more parents that say, heck yes, I am.
The ARC wants parents to know schools do still have to follow your child's IEP or individualized education plan, even during virtual learning, even during a pandemic.
If your child is not capable of wearing a mask, then that needs to be in an IEP so that the school knows that and knows how to work around that.
We asked the Indiana Department of Education what they're doing to make sure students with special needs do not fall behind.
We have to remember that our students with special needs still need to be served. And so our cry, or our job, our drive from the very beginning is, and to this day, is how do we work with those districts to make sure they understand you still need to provide those services.
IDOE spokesperson Adam Baker says when a district fails to provide services, schools can be required to offer them after the fact.
That does help try to provide those services when those services could become available.
IDOE also created this document full of resources and guidance for special education.
Oh, you want to play with the ball then? Okay.
Ultimately, Marvin decided on virtual learning for his daughter. He knows it will make working from home more difficult, and Ambreen will miss out on interacting with her peers.
Now I'm like, am I going to be able to teach her like a teacher? I'm not licensed. I'm not trained to be a teacher. Can I do the same job that the teacher is going to do at school for us?
Marvin is working with Perry Township to make sure the first grader is getting therapies she'd normally get in the classroom. The district told us, despite the challenges that have emerged during the pandemic, teachers continued to build relationships with parents. They have ongoing conversations to ensure students get individualized therapies and services, as well as meet academic and social goals. For Marvin and many parents with children who have special needs, their biggest concern is making sure their kids are included and not treated differently, even during a pandemic.
It's just scary, you know?
Still ahead, the demand to make sure you find out if a student in your child's class tests positive for COVID-19.
And Dr. Deborah Burks. She explains why the choices we make right now can determine whether Hoosier kids can return to their classroom.
Expo.com.
I hope that this is an opportunity to teach our children how to live with uncertainty and resilience. I spent the summer preparing to go back to school in person. I've been collecting a mask wardrobe for my children.
Nothing is universal for the start of this school year.
We are seeing a patchwork among the school districts. Some are only doing remote learning, like IPS and Washington Township. Others are using a hybrid model, in-class learning as well as virtual learning, like Perry Township and right here, Franklin Community Schools.
And Avon families were among the first in central Indiana to send their students back to the classroom.
I don't like being the first school to go back, but somebody has to be.
I wish they would have just said, this is what we're doing, no choice. So then you don't feel that guilt. It's because you feel guilty either way.
In the classroom, the Department of Education's guidance includes smaller groups for younger students, alphabetical order seating for older students to better help with contact tracing, and masks they're required by schools.
Call 6 Investigates Kara Ketty. She has the latest on the efforts to keep schools accountable and parents aware.
Representatives Ed Delaney and Tanya Pfaff, who is a teacher, are urging the state to track and publicly report cases of COVID-19 in schools. They point to confusion surrounding nursing home data as one reason why the state needs to track school data from the beginning of the school year. They suggest an online dashboard that highlights cases by school district and school building.
The rumor mills are going to be spectacular. So the parent grapevine will know the first time the first kid or teacher or whatever has a positive test in the school. Okay, but that information is never reliable, never accurate, never fully disseminated. So I hope that we're ahead of the parent grapevine so that we don't have rumors and we don't have bad information.
We reached out to the State Department of Health, who told us local health departments will get information about any case in school and then will begin contact tracing. That's what happened when the results of a Greenfield Central junior high students test came back positive after the first day of school. ISDH says they are working on additional resources to ensure schools are quickly notified of cases, but those plans are still being developed. When it comes to handling cases, Scripps reporter Usher Qureshi shows us the CDC gives a lot of latitude to school districts to make that decision.
The message from the White House has been loud and clear.
Yeah, I would like to see the schools open 100%.
Most doctors, educators, and psychologists agree that going back to school would be in the best interest of students. But what happens if just one student contracts the coronavirus? Would that force a shutdown? The CDC says no.
Getting people to understand that the knee-jerk answer is not there's a single case in a school, that then equals closing back down the school.
Once you start getting into dozens or even more kids and teachers starting to get infected, it's going to be very hard to keep that school open.
Dr. Ashish Jha is a professor of medicine and the director of Harvard University's Global Health Institute.
We have to have really smart planning, and we have to have a clear protocol for how to identify kids and teachers and staff who get infected, and then what to do when we identify them. And I just haven't seen that kind of clear protocol yet.
The CDC did issue new guidelines for school reopenings. They include encouraging social distancing, spacing out desks, and requiring face coverings. But the guidance leaves it up to states, schools, and local health departments as to how to precisely handle an actual outbreak.
What we have is patchworks not just across states, but even within states, across communities. States are turning over the responsibility to individual communities and saying, you figure it out.
Recommended strategies from the CDC's guidelines include immediately separating staff and children with COVID-19 symptoms, setting up safe transport for anyone who is sick to their home or to a healthcare facility, closing off areas used by a sick person, cleaning and disinfecting after 24 hours when possible, and immediately notifying health officials, staff, families, and anyone who may have had close contact with the infected person while maintaining confidentiality laws. Still, there is concern.
We can open schools safely, but key to that is making sure the level of community transmission is pretty low, so you don't have sort of raging wildfires in the community, because it's going to be very hard to keep those fires out of the school.
I'm Usher Qureshi reporting.
This is the school clinic, and the school nurse will play a critical role in all of this. I sat down for an exclusive interview with Dr. Deborah Birx, one of the leading doctors on the White House Coronavirus Task Force. She says the choices that adults make when it comes to wearing masks and social distancing will be key to whether students can safely return to the classroom.
Well, my best advice for every place like Indianapolis specifically and Indiana in general is what the governor has done and what the people of Indiana are doing now. If they commit themselves to wearing masks in every single public place, in every place where they interact with others, if they stop going to bars, we can get our kids in school. Because your test positivity will drop dramatically, your cases will drop, and will have a tremendous impact on the spread of this virus. Kids can be in school safely. We know that children get less disease, but we're also concerned about the parents in multi-generational households, and we're concerned about the teachers.
Still ahead, the signs to watch for if you think anxiety about returning to school might be impacting your students' mental health.
Today.
Welcome back. I'm Amanda Starantino. Even during a regular school year, going back to school can be stressful for Hoosier kids. And with the uncertainty of going back to class in the middle of a pandemic, it's very important to keep track of your child's mental health as well as your own. Dr. Jerry Fletcher is a child-adolescent psychiatrist at Ascension St. Vincent. He says the pandemic is the reason behind a lot of depression and anxiety he is seeing in his patients.
Kids understand the isolation and the lack of communication, lack of attachment to friends as becoming a significant issue, both in terms of their self-esteem and how well they relate to the rest of the world.
The best thing a parent can do is keep an open conversation with their kids. This helps ease any anxiety they may be feeling. Dr. Fletcher explains that the fear kids have right now is not necessarily the pandemic itself. It's the fact that their lives are so different. It is important to validate their feelings and keep things honest.
Acknowledge the fears the child has and to be able to process those fears regularly and continue to do that over time. So repetitive discussions that are based on positives, discussions that give them the sense that lots of people are working on this issue, that there are smart scientists that are trying to get a vaccination so it goes away. So give them the hope that things are going to be stable in the future. But in the meantime, do what you can to stabilize each day for them.
Parents should also try to keep the children's schedule as consistent as possible. This can help with making a very unpredictable time feel a little more secure.
The children's in particular need to have a schedule so they keep their life predictable. So as best you can, you want to keep a schedule, not just at school, but at home.
Mental health experts say it's important to understand how your child feels about going back to school and what their concerns are. Signs that they are anxious about returning to school include significant changes in their sleep patterns or nightmares, changes in appetite, headaches or stomach aches, being more irritable or frequent meltdowns, or withdrawal from family, friends, or other activities. If symptoms of anxiety are getting in the way of everyday life, it may be time to see a professional. That goes for kids and parents. You can find a list of mental health resources and tips for talking to your kids about going back to school, as well as some books that can help with first aid nerves at theindychannel.com/safelybackToschool.
The strength to make a difference.
This is a problem then that will be still plaguing our economy decades from now if we don't find a solution.
Whether it's reading or math, technology is making remote learning possible for thousands of Hoosier kids this fall.
But for many, internet access is a barrier to learning. A new Ball State study shows that up to 85,000 students in Indiana do not have internet access at home. That's at least 1 out of every 16 kids. Experts are encouraging lawmakers to take action.
I do think it's going to require the state General Assembly re-looking at how we deploy broadband, how we allow communities to help subsidize that. And at the same time, and this is a much more urgent problem, is to find alternative locations for kids to go to school. We have empty big box stores that could be converted to learning centers where Wi-Fi could be provided.
Some districts, like Indianapolis Public Schools, have been able to supply students with portable Wi-Fi hotspots. Several internet providers offer programs for eligible low-income households. For more on those resources and the school district's latest plans, you can go to our website, theindychannel.com/safelybackToschool.
For all of us at RTV6, thanks for watching.
Good night.